Forehead lowering surgery. Forehead lowering surgery, also known as forehead reduction, offers a solution for individuals looking to restore facial balance and address concerns related to a large forehead. Whether caused by genetics or hair loss, this procedure can boost confidence and harmonize your appearance. The causes of a high hairline can vary, including genetics, hormonal changes, medical conditions or treatments, aging scalp trauma, improper surgeries. Forehead reduction surgery focuses on reshaping the hairline and upper face. For many women, a lower and more rounded hairline enhances balance, while men often benefit from a square-shaped design. Typically, a 2 cm reduction in the hairline is achievable. This change is customized to meet the patient's expectations and facial proportions. Ideal candidates: women with high hairlines, men with thick hairlines and no history of baldness, individuals with good skin elasticity, those distressed by a disproportionately high forehead. Preparation starts with a preoperative assessment, typically 2 weeks before surgery. Key steps include stopping smoking and certain medications, avoiding herbal remedies, vitamins, and supplements, fasting for 6 hours before surgery. The procedure involves administering local anesthesia, making an incision at the hairline, removing excess skin, sewing the ends together for a natural-looking result. Recovery is straightforward. Return home the same day. Resume work or school within 7-10 days. Manage swelling and discomfort with medication and ice packs. Hair washing can typically resume within a few days, while strenuous activities should be avoided for 2-3 weeks. Final results become visible after several months. This surgery offers numerous benefits, including improved facial balance, enhanced self-confidence, a more youthful appearance, permanent results compared to temporary treatments like fillers, increased hair density at the hairline. While the procedure is generally safe, potential risks include hair loss or damage to follicles, infection or delayed healing, temporary numbness or scarring, rare complications like deep vein thrombosis or pulmonary embolism. If you're considering forehead-lowering surgery to enhance your facial harmony, our skilled team at Avicenna International Hospital is here to help. Contact us today to schedule your consultation and take the first step towards renewed confidence.